So good morning, everyone. Thanks for joining us for the 5th annual Dahdaleh Global Health Graduate Scholars Symposium. My name is James Orbinski, and I'm the director of the Dahdaleh Institute Global Health Research. And I'm very happy today that we have 6 highly accomplished graduate students, each of whom will be giving a short 10-minute presentation on the progress that they're making or have made around their research projects, and hopefully offering some insights as well about their research. But before we begin, I'd just like to start with a land acknowledgement, excuse me. So this is a hybrid event, so there are many people online, and land acknowledgements are about the physical land that you're on, not some virtual concept. I just ask people who are online to take a moment and also acknowledge the land that they are on. So today, I'm here with a group of people at the Dahdaleh Institute at York University on the campus in Toronto. And Toronto is the traditional territory known as Takaranto. And I acknowledge its current treaty holders, who are the Mississaugas of the Credit First Nation. I also acknowledge the traditional territory, that this is the traditional territory of many Indigenous nations, and including its current treaty holders, who are the Mississaugas of the Credit First Nation. It's also the traditional territory of the Anishinaabe Nation, the Haudenosaunee Confederacy, the Huron-Wendat, and of course the Métis. And the territory is subject to or under the Dish with One Spoon Wampum Belt Covenant. And this is an agreement to peaceably share and care for the Great Lakes region. And so with that acknowledgement of the land that we're on, we have a very, just a really rich lineup for the day. But before I introduce the speakers, I'd just like to take a moment to recognize the contributions of all of the Dahdaleh graduate scholars, including those who aren't here today or who aren't able to present. The work that is taking place at the Institute is really stellar work under the 3 themes of the Institute, which are planetary health, global health and humanitarianism, and global health foresighting. And only part of that work is being presented today. And I'm very, very pleased at the quality overall of the work and the range of work that's taking place at a graduate level here at the Institute, and I'm particularly excited about seeing what is actually presented today. So the format for the symposium is that it's a 2-hour event. We'll end formally at 12:30. We'll start with the first 3 presentations, and that'll be followed by a roughly 20-minute question and answer and discussion period. We'll take a little break, 10 minutes, and then we'll continue with the last 3 of 6 presentations, have another brief question and answer period, and then we'll wrap up pretty tightly around 12:25, because there is a gathering that's planned for a little bit later, which is a follow-up to the symposium. And we're all looking forward to that, of course. And just a couple of gentle reminders. The seminar is being recorded. Please, if you're online, please mute your microphone unless you're presenting or actually asking a question. And do note that we will be looking at the comments and questions after all of the presentations, and also during the presentations, and we'll do our best to integrate to integrate any comments or questions that might emerge online into the actual living space that we're in here today. So on the first, I'm just going to briefly give an introduction to each of the first 3 speakers, and then I'll call on each to present. Michaud de Santi, if you could just get yourself ready, you're going to be our first speaker. And Michaud is a PhD candidate in the Department of Civil Engineering at the Lawson School of Engineering. He is also a research fellow here at the Dahdaleh Institute, and works in our humanitarian water engineering lab as a graduate student. And he's worked specifically on what we call the Safe Water Optimization Tool. And he's going to tell you a little bit about that and some of the progress that we've made around that tool, or that set of tools, actually, over the last little while. Michael's developing new modeling tools to using AI and epidemiologic parameters to predict water quality in refugee camp settings and in settings where there are internally displaced persons. And his current research focuses on developing holistic tools for assessing water safety and water safety risk in humanitarian response settings. So Michael, I'm going to ask you in a moment to begin, but I'm also now going to introduce Valerie Lawson, who will follow Michael. And Valerie is an international student from Ghana, and she's currently pursuing a master's degree in development studies here at York. And her academic journey is deeply rooted in a passion for social and political change, and personal experience, her personal experiences with healthcare access in both Ghana and elsewhere have inspired her to focus her research on healthcare policy and finance in Ghana, and she aims to contribute to improving the health sector in Ghana. And then following Valerie will be Brian Waters, and Brian is our second-year PhD candidate in geography, and his work centers on water security, aiming to use water interventions and investments to not only address health challenges, but also build resilient social and economic systems that reinforce the sustainability and equitable operation of the water resources themselves. So those are just very brief introductions, and go on at some length by each of you. But with those brief introductions, I'm just going to ask Michael to begin. So over to you, Michael.
All right, thanks so much, James, and thanks for that introduction. Yeah, let's dive in. So we're going to talk today about some work that I've been doing, prototyping some tools to link water quality to health risks in the Kyaka 2 refugee settlement. So I'm going to start by briefly talking about water safety risks in emergency settings. I'm going to go quickly through this because Imran covered it a couple weeks ago in his seminar, and it was really great. And if you missed it, it's on the Dahdaleh Institute YouTube channel, so like and subscribe. We're talking about displacement, risks, and recontamination. So first of all, just to understand the broader context of this work, displacement is increasing. Climate change, conflict, and other emergencies are leading to really unprecedented levels of global displacement. And displaced persons, especially in refugee and internally displaced person or IDP settlements, face an elevated risk of waterborne illnesses. And even when so all of these pathogens highlighted in red are pathogens that are either waterborne or can become waterborne. And that can become is really critical because the paradigm for water supply in humanitarian settings is particularly prone to recontamination. So often piped water distribution systems are intermittent, meaning they're only pressurized when they're delivering water, and they depressurize when water's not available. During those low pressure periods, pathogens can get into pipes. And then I think more importantly is their central collection and then household storage and use. And in that paradigm, more or less every single study of that paradigm of water supply shows that there's always potential for recontamination. So that's why even if you have a foodborne cholera outbreak, it can start spreading in the household through stored water. And so let's talk specifically about the Kyaka 2 refugee settlement. So this is a UNHCR settlement in Western Uganda. Until about 2017, it was hosting about 30,000 refugees. And then with an escalation of the Ituri conflict, it's gone up to about 120,000 refugees. So that gives you an idea of a really rapid increase in population. And since then, we've also seen an increase in outbreaks of waterborne illnesses, shigellosis, cholera, schistosomiasis, and generally acute diarrhea. And it's got a fairly complex water system. There's multiple sources. There's untreated boreholes. There's some natural springs. And then there's the Sway water treatment plant that supplies water through a mixed piped and truck supply. And since you invited the engineer to present, we can't not talk about infrastructure. So here's a little bit of a layout of how the water supply system works in Kyaka 2. There's a dam on the Kaiju River. That is where the water is obtained. And then it's aerated, coagulated, and settled at the Sway water treatment plant. And then we have chlorination at two separate in the two separate distribution systems separately. So for the truck distribution system, chlorination is happening in the truck. For the pipe system, it's happening in central reservoirs. Really important because chlorine is effective both as a disinfectant. So if there's pathogens in the treated water, it'll kill them. But it'll also kill pathogens that get back in if there are recontamination events. So it's really important to maintain adequate chlorination while producing a conducive water matrix to support chlorination. And then, you've got pipe and truck distribution, but still goes to tap stands and then collected from tap stands, stored and used in the dwelling. Here's just some pictures of the water treatment plant, including, on the right at the top, we've got that kind of fountainy looking thing is the aerator. That's to remove iron. There's a lot of iron in the Kyaka River. And at the bottom, you can actually see some of the settling plates. And we see, again, that metallic buildup. And so our research question was, how can we use predictive modeling to help local operators optimize water treatment in Chakatu to minimize water-related health risks? So try to bring down that burden of waterborne illness. And I think that begs the question, why modeling? I'm a modeler, so I kind of always think about this, but I think it's worth explaining. And it comes down to a temporal and bit of a spatial mismatch. Because operators work in the treatment plant and, where they dose coagulants, operate flow rates, and then dosing chlorination in the trucks and reservoirs. The guidelines for water systems typically require monitoring at tap stands, but people don't get sick at tap stands. People get sick consuming water in the dwelling. And what modeling allows us to do is to track water quality through these points to allow us to optimize upstream decisions to get outcomes that we want further downstream. And so that brings us to the model that we're prototyping and presenting today. And this is what we're calling an ML-QMRA model, and it's composed of 3 components. The first is a water quality model from treatment to consumption. Then next is we've got an ML model linking water quality, so rapid parameters like chlorine, turbidity, pH, that you can measure within like 50 minutes to E. coli and pathogens, which are much harder to monitor. And then linking those to to health risk using QMRA, Quantitative Microbial Risk Assessment, which is a health risk model fairly widely used in water distribution systems. And what's cool is we can run this model what I call forwards and backwards. So we can run this forwards, starting from the treatment plant, see what treatment's done, and then forecast water quality throughout the system, link to pathogen concentrations through fecal indicators after we've got household water quality, and then assess risk. That's kind of what I presented on the previous slide. We can also run it backwards, run it the other way, where we determine the allowable risk that we're willing to accept, household probability of infection, and then from there determine what pathogen concentrations can we have in the water and still achieve that, and from there work back, what does the water quality need to be, and then work all the way back to treatment plant to figure out what treatment activities you need to take to achieve that level of risk. So again, this is what we're presenting today is a really brief prototype based off a data set that we collected through the Safe Water Optimization tool in 2022. So the purpose of that study was to test the SWOT in a new context. And we collected some data that enabled this prototype, but isn't like a full perfect data set or even really close to perfect for what we want to do with this. So we can talk about that in the Q&A period if you're interested. But the 2 big limitations, we don't have much fecal indicator data, and we don't really have good treatment data. So I'm going to present the ML-QMRA results for assessing risk and coming up with water treatment guidelines for this site. But first, I do want to highlight, before we get there, that there is a better way to do this. This ML-QMRA model, it's never been done in any type of context, even within much more data-rich environments. Like the City of Toronto does not have an ML-QMRA model. And we're building a very complex model to enable operators to treat to a very high level of proficiency, because there's such a mismatch in the money that we put into generating humanitarian need through military spending versus what we actually spend on alleviating humanitarian need through humanitarian spending. So if all the engineering is kind of goes over your head or you don't care, I still think we need to keep our eyes on this, that everything that we're doing is because we're not really funding humanitarianism to the degree that we need to actually provide better solutions in these contexts. And so from a risk perspective, these graphs show for 3 different pathogens the assessed daily risk. So these box plots are showing the distribution of daily risk, and then the blue is showing the mean daily risk. And first of all, you'll notice that the blue is fairly high relative to things like the median shown in orange, or even the interquartile rate shown with the box. And that's because we have a few outlier, like kind of the very upper, like very unlikely but highly critical risk levels are very, very high. So that's why you see such high mean risk. What I think is really important is we see there's a lot of fluctuation in the daily risk for all three parameters, pathogens that we looked at: pathogenic E. coli, Campylobacter jejuni, and rotavirus. And I think that that's really important to keep in mind because a lot of water quality guidelines are very static. And a lot of the way that people try to tell operators how to treat is very static, is, figure out a dose, always apply that dose. But we can see, and this is partially a factor of being a surface water source. There's a lot of variability in the source water quality. So static treatment on dynamic water quality leads to dynamic risk. So we actually need treatment to be more responsive to source water quality and changes on site. But we can also then run this back, as I showed, to come up with a water quality target that's going to achieve a desired level of risk. So typically we would look at something like 1 times 10 to the negative 4 probability of infection. Because of the water quality paradigms and water treatment distribution paradigms, that's not really achievable on this site. So we said, okay, what does the water quality need to be at the taps and at the point of collection to be within 5% of the worst daily risk that we see? We came up with this heat map. You'll notice it's a bit grainy. That's, again, a big factor of having limited data to work with. So we kind of get a lot of places within the solution space where we don't have data, so then you get these splotchy results. But from this, we can roughly interpolate that this line roughly is where you want to be to ensure, within 5% of your worst daily risk. And so what we can actually do is figure out, based on different turbidities, which is important because turbidity, after you clarify, doesn't change a lot at this site. We can say, okay, well, on a low turbidity day where we have 1 NTU, we need to make sure that there's 0.85 milligrams per liter of FRC at the tap stand. On a higher turbidity day, let's say it's 5 NTU, we need about 1.05. And then on a really bad day, or in the truck system where we tend to see more increases in turbidity over time, we need to go up to like 1.25 milligrams per liter. So this is really important because it gives us some flexibility in how we treat the water. So I'm running very close to my time limit, so I'm just going to hop to next steps. First of all, I've complained about this data set. This is really a prototype to set up some field work that we're planning to do. So we've got field work coming up to do some better treatment data collection, and also really crucially to work with operators to, and this is something where we're partnering with Dahdaleh Institute, who presented last week, where we're going to actually work with them to figure out how this type of modeling fits into their workflows so that we're actually recommending actions they can take and relevant activities. I also need to localize the QMRA model. A lot of the data we were working with for water quality was local, but a lot of QMRA data is actually not in local, typically from Dutch sources. And then we need to expand to other water sources. So the Swaysway water treatment plant serves about a third of that population. We also need to start expanding to looking at boreholes. And just as a bonus for my supervisors, we also want to start publishing this data. So thank you so much. I look forward to the Q&A, and I'm going to pass it on to the next presenter.
Thank you very much, Michael. That was great. I have lots of questions for you. I'm sure others do too. But that was great. Thanks so much. And before we go to questions, we're going to go to Valerie and then also Brian. So Valerie, Lawson, you're our next speaker.
Okay. Thank you very much. So my research, that's my title, healthcare.
Could you speak very loud because I can hardly hear you?
Okay, so that's my research title, healthcare access and analysis of the the National Health Insurance Scheme in Accra, Ghana. Yeah, so it focuses on healthcare, health policy, health financing, mainly looking at the health insurance of Ghana. So
Can people hear online?
Yes, it sounds excellent.
I'm sorry?
People can hear.
Yes, good.
All right, go ahead. Here.
So this is a brief agenda. We look at my research questions, objectives, my fieldwork experience, data analysis, findings, and then recommendations. So a brief background of Ghana's NHIS was established in 2003 by the government of Ghana to provide financial access to quality healthcare for all residents in Ghana, including persons who are on a visit to the country. And in 2023, there were 17.9 million subscribers on the scheme. And as of September 2024, there are 478 NHIS credentialed health facilities in the Greater Accra region where the study is focused. The NHIS has a cocktail of funding, mainly funded through taxes. We have the NHIL, which is 2.5% of VAT, if I should say. So 2.5% levy on the goods and services that are collected under VAT, and then 2.5% of workers' NIT contributions, so people working in the formal sector. And then we have annual premiums paid by the informal sector members. And then anyone who doesn't fall between these two categories, they have registration fees. And then we have returns on the National Health Insurance Fund investments, which needs to be approved by the Parliament of Ghana before it's actually issued out to the NHIA. And then we have the international donor support, so grants, donations that come through the NHIS fund. So although, it's highly funded through taxes, there are still challenges that the NHIS faces. So in 2022, although Ghana was commended by the World Bank for achieving a 55% coverage rate, making it one of the leading health insurance programs in Africa, there are still, issues concerning out-of-pocket payments, which have been raised by Ghanaians. It's also reported that Ghana has the highest out-of-pocket healthcare payment in Africa, even though the study was done in 2021, and now there's Nigeria and then Egypt who have equally high figures. It still shows that this issue is alarming. It's quite alarming. So the other challenges that the NHIS also faces, which includes heavy reliance on tax funding, there's insufficient administrative and registration system, there's cost escalation, high levels of abuse. And regarding tax funding, current statistics show that the government owes the NHI 2.4 billion, which is approximately 210 million Canadian dollars. And then for administrative and registration system, I witnessed this firsthand during my internship with the NHIS district office, where if there are network issues, it creates certain challenges when it comes to registration and record keeping. So I wanted to focus my study on out-of-pocket payments. So despite all these challenges, I was just focusing on out-of-pocket payments that NHIS subscribers face. And the existing literature on this is mainly quantitative, mainly focusing on the perspective of the service providers or the policymakers, with not much voice given to the users of the scheme themselves. So this was a way to highlight the voices of the people regarding the challenges they are facing with healthcare. So that brings me to my research questions. Which factors influence the occurrence of out-of-pocket health expenditure with regards to NHIS, and how does health expenditure affect the healthcare seeking behavior and financial well-being of NHIS subscribers? So I feel this link is what is missing in most studies. And my objectives are closely tied to the questions. Yeah, so for my fieldwork experience, I first gained ethics approval in the second week of April, and I collected my data during between June and July. And I'm using the phenomenological approach, which makes me explore in depth the challenges that the NHIS subscribers face when it comes to healthcare payments. And what better way to do this than through in-depth interviews? So I interviewed 30 NHIS subscribers in Accra using a demographic form and then an interview guide. And for my recruitment, I used social networks. So I designed this flyer, which I actually distributed through WhatsApp. And that was a bit of a challenge because I thought, hey, this flyer is cute enough, so people will be interested. But then no, that wasn't the case until I reached out to people and then told them about the study. That's when I got people, being interested. And then I used snowball sampling as well. So people I had already interviewed, and I just told them that if they could recommend anyone who they felt could, be a best match for this study. And then through my internship, so the NHI subscribers that came to the district office where I worked, I directly approached them, made them know that I'm having this study, so if they're interested. So I got more participants through that method, yeah. So for my data analysis process, I'm relying on the perspective of Brown and Clark to allow me to identify and analyze certain patterns that are coming out of the data. So first of all, I transcribe the interviews manually, all 30 of them. And then I moved on to coding. So with the codes, first of all, I had preconceived codes from the literature and then from my research questions as well. And then I now relied on the data I had already transcribed to get other codes from the data directly. So it was both deductive and then inductive. And then these codes, I had to review them again and then now put similar codes into categories. And then with the help of the categories and then with reliance on my research questions and objectives, I'm now, generating themes out of them to have a coherent story to tell. So that is my data analysis process. And then for my findings, which are tied to the research questions. So when it comes to determinants of out-of-pocket health expenditure, it's mainly based on finances. So it's financial, it's structural, and it's behavioral. So for financial, it's mainly based on costs. So if someone should go to the hospital and has, his or her NHIS card, thinking, it's going to work, there are times maybe the medicines that are covered by the NHIS are not available. So they end up, just paying for what's available. And for structural, there are some participants who faced issues with the healthcare system and then with the scheme in general as well. So for instance, they go to the hospital, there's a network issue, which is causing a delay in their NHIS being verified for them to use. So all these delays also create queues. And then when there's a queue, it means delay in treatment. So people just, end up directly paying for the service, regardless of they having the NHIS. And then behavioral, there were some participants who acknowledged that, yes, they don't know what the NHIS really covers, all the benefits under the NHIS. So, if they're told to pay at the hospital, they just pay for it because they are there for, healthcare. So if they have the means, they just pay for it directly. And it affects the way they seek healthcare, mainly when it comes to value-based healthcare decisions. People look at the quality of healthcare they are going to get. If they feel, most of them feel that the NHIS covers really cheap, in their words, or really, ineffective or inferior drugs. Yeah. So they feel that if they are going to pay for it, most of the drugs are, the ones that are effective. So they are willing to, pay for those, or rather go to maybe a private hospital where they can actually pay and then access quality healthcare. And then cost influence, there are some participants who actually weigh their options first. So if they don't have the means to even go to the hospital, they rely on traditional medicine, or some just directly go to the pharmacy to purchase medicines because they already know what they are going through. They already know that if they should go to the hospital, they'll be told to pay these same medicines. So they just, directly go to the pharmacies. And then all these have an impact on them financially. So how do some of them cope? Mainly through reliance on, family supports or savings. So if they have some savings there, and then health emergency should come, they'll just, rely on their savings. So for recommendations, this came directly from the data, from the responses of the people. People are asking for, or they're requesting public education and awareness on the NHIS coverage benefits and then card renewal process. So with this, during my internship, I was able to help a bit when it came to card renewal process. So there's a digital process where you can download a short code, which is *929. Many people didn't know this, so they'll come all the way to the district office just to renew their NHIS, while they could just do this in the comfort of their homes. And then people are calling for an extension of the coverage to include more medicines and medical conditions. So although there's a huge list of medicines, they feel that they are still paying for them. So they just feel it's not covered, but maybe in the handbook it's supposed to be covered, but they just don't know. So they are calling for an extension. And then restocking of medicines covered by the NHIS in health facilities. So that's a huge challenge. They go to the hospital and then medicines are not available for them. So it's prescribed for them to just buy it later. So a delay in healthcare. And then people are calling for collaboration between the NHI and then hospitals to improve the reimbursement process, because when there's a delay in reimbursements, the hospital is affected, and then indirectly it now goes to the patients. They have to bear the cost as well. And then revision of funding mechanisms of the NHIS. So it shouldn't solely be, the taxes. They want a way that it can be revised so that we don't solely rely on taxes, but then there are other means so that the NHIS can also be sustainable. And then there's a creation, they call for a creation of good working conditions for healthcare workers, because if the working conditions are poor, the people who are going to really suffer, or people are those going to suffer, who will be at the receiving end is the patients, the subscribers themselves. And then lastly is improvement in the quality of service in public hospitals, because it's the public hospitals that usually make use of the NHIS, even though, it's both private and public. Yeah, but the service they get at the public hospital isn't really, quality to them. So they feel, if there can be an improvement in any way, the government should look in that direction and then sort of work things out for them. Yeah. So I have these people to thank: my supervisor, Dr. Mohammed Sise, for his support, DI and Harriet Tabman for the financial support, and then the NHIS district office where I did my internship, and my research participants for all the valuable insights, and then my graduate program for the opportunity to conduct field work and an internship, and then my colleague, Dr. Sam, for helping me review and then edit this presentation. So thank you all for listening.
Well, thanks so much, Valerie. That was great. Thank you. Very, very good. And our final speaker for the first part of the symposium is Brian Waters. And Brian, are you ready?
How do I get there?
Yeah.
Hit the arrows?
There you are.
There's me. Cool. I see what you've done. Cool. Hello, everybody. Thank you for all who are online, and thank you everybody who's in the room today. I actually wanted to start off my presentation by thanking Dahdaleh in general. When I first got here last year, one of the first things I did was sign up for the humanitarian water engineering course. And last year, in the spring, was my first opportunity to actually present on my research. So a lot of the feedback I got from that presentation will appear in this presentation and continue on in my research going forward. So having said that, if it lets me go forward.
Face the road that way.
Later, is it plugged into this at all? Doesn't matter.
There you go.
Cool. My research is based on a fundamental contradiction that I find in all of the government documents and published papers. They generally say that Freetown has enough water for 500,000 people, yet all the same documents will say that there's up to 1.5 million people who live in the city. So my question just comes down to, where are those 1 million people getting water from and how? I think that this question is important because not only to solve this question, but because in the literature I read that one of the Slumdweller International's key sayings or key ideas is that no one knows more about how to survive poverty than the poor themselves. And I apply this to water, thinking nobody knows how to deal with and survive in water insecurity than the people living with water security themselves. So if we can figure out what the programs they do, what the management techniques, what technologies they use, and invest in their scale, invest in their current ideas, we may be able to scale them up in a more sustainable and resilient way. So bringing this together, I'm bringing together 3 areas of research to investigate this. The first is political ecology. And this is the area of study that I'm using to investigate questions that you can see, the question that you can see below. But what I see when I'm in Freetown is that most water interventions break down within about 2 to 3 years. When we increase technology, this can increase output or even reliability. But over the long term, I find that the more technology there is, the more likely it is to break down sooner. So therefore, technological fixes definitely have their uses and their place, and and their benefit. However, I'm trying to look into the management structures of these water sources to figure out how can we make sure that these people, the people who are running the water sources, are doing it in a way that's reliable and sustainable and have access to the resources that they need. My second area of research is global health. This is something I've only begun to work through, so I don't want to go into a lot of detail, but I do want to say that the work that I'm doing takes a lot of inspiration from John Snow's map of cholera outbreaks in London. I think that this is a perfect place for me to be working at because he fundamentally linked water to health through geography. And as a geography PhD, this is something that I intend to take into my research now. The kind of questions that I'm looking for in global health are, how can health outcomes be maximized by the geographic location and management of water structures by geographic location and the management structure of water sources. Finally, the third area of research, the third area that I'm using to understand all of this is systems thinking. One of the first things that I'm using is both geography and systems thinking concepts of scales. And what I would like to figure, and within this, what I find is another issue within Freetown. Municipal scale water is financially impossible in the city. The small scale is kind of the only way forward, because there's simply not enough capital and money within the city to run, operate, and maintain, much less repair the current state of their municipal water system. So I want to know, so if we're going to start, so if the way forward is small scale water infrastructure, how can those small scale water sources influence larger social and physical infrastructure around water? And finally, what I'm looking into is how can systems thinking not only help me understand the social infrastructure around water sources and the governance structures around it, but how can it actually help design better water systems physically? So what my research is, while I have a lot that I'm planning on doing over the next 2 or 3 years in country, the actual research that I'm going to be writing my PhD on is also composed of 3 parts. The first part is in the backbone is the survey. This is really ambitious, but it's also my bread and butter. It's what I'm good at, and it's what I have a lot of experience in. And so so what I plan on doing is doing 150 surveys in 4 communities, and then repeating those surveys over 12 months every month. The reason why I want to do this is to measure water insecurity and see how it varies throughout the year. I find most research that I see right now is currently does one-time surveys, or at best 2-season surveys. And I think that this indicates, as the first presentation did, a static understanding of water. And even those who are doing 2-season surveys create more of a linear relationship between time and water insecurity. Yet I think that there's a nonlinear relationship that needs to be explored and understood. The second part of this is mapping. The month before I go in to do the surveys, I will be mapping all the publicly available water sources within the 4 communities and gathering information on their prices, quantity, location, and who's running them, other pieces of information that I've done before as well. One of the things that I'll be able to do with this information is then connect the water sources themselves to the households in each survey. In this way, I think I'll be able to show how there's actually a bit of what I believe my hypothesis is there's going to be a migration of water sources by the community throughout the year. Generally, a concentration on particular water sources as the dry season continues. And finally, there's going to be focus group discussions, because just because I have the data doesn't mean I really understand it. So I'm going to use these focus group discussions every 3 months with 2 sets of 12 participants to discuss changing their internal changes to their strategies to address water security throughout the year. I'm also going to be discussing inconsistencies or insights or contradictions that I find in the survey data, so that way I can better understand it. So at the end of this, and I just have I wanted to end this with a couple of asks instead of just a presentation of what I'm doing. And the first thing is to support and apply for 2 research grants that I really got my eyes on over the next year. The first is the International Doctoral Research Award, and the second is the Shirk Impact Award. The first is more common, but the second one is particularly prestigious. So if there's anybody with any insights, I would really appreciate assistance in applying and any advice or guidance on it. The second thing is partnerships and collaborations. I hope what came through here is this is more than just a research project. It's a research platform, and I'm really trying to use it in order to get out of the siloing and isolation that research can really bring. So if any of this sparks interest, or any of this sparks ideas for partnerships or questions that you'd like to work with me on, I would be more than happy to meet and talk about what kind of things we can work on together. Thank you very much to everybody here and online, and to the Dahdaleh. And if you'd like to contact me, here's my information. Thank you.
That's great, Brian. Thank you. Great. So just open up the space for questions. And is there anybody in the room that would like to ask a question? And please introduce yourself if you are. Go ahead.
Question for Valerie. Example, into Accra, the question that you are addressing is the out-of-pocket expenditure. But before you do that, what is the level of your service alignment the number of physicians and the healthcare available for
The number of health facilities available.
yeah.
Can you repeat the question for people online? I don't think the
Yeah, the question.
microphone has picked it up.
The number of doctors and nurses per capita or per, do you have sufficient service providers available?
Well,
Could you repeat the question? Would you mind?
so he wants to find out the, should I say, the health infrastructure in Ghana with regards to the health facilities, the health service workers themselves. Yeah. So is it sufficient? To an extent, I would say yes, because in either Accra or in the entire country, we have, should I say, over 4,500 hospitals that are even credentialed under the NHI. So like that's just the NHIS alone. So you can see the health facilities are quite sufficient, but then the population is also, increasing. And then there are, should I say, there are plans of certain hospitals being built maybe in the future, looking at, how the population is increasing rapidly. But when it comes to the healthcare providers, we have doctors who are, who have plans of actually leaving the country for, should I say, better working conditions, because the working conditions in Ghana, they cannot be compared to other countries, but I should say. They have like better working conditions when it comes to healthcare, the pay they enjoy and everything. But with Ghana, that's a challenge. Most of them feel they are not really, their work is not being valued enough. There are doctors who have actually started working in hospitals, and for 6 months, they don't even receive their pay. And, that's a challenge. So we could have the facilities, but then the working conditions for even the workers themselves, even, putting more effort in their work is what is really lacking. So it's not balanced in a way, yeah.
Did you have a question?
Yes.
Yeah, just introduce yourself if you don't mind.
See. Caroline Duncan. Hello. Hi. Your research seems really ambitious, which is fantastic, but I was more curious, how do you plan, I guess even timing, like how much time do you think you're going to have to do 150 surveys?
Yeah, the first thing that really would make
Seems
sense.
like a lot of hours.
Yes.
Level.
Yeah. The first thing is I'm planning on the repeated surveys to be like 10 to 15 minutes. Whatever repeated information I want for all 12 months is going to take less than 10 to 15 minutes. That's the first answer to that question. The other thing is that I'm not making these surveys on my own. And I'm actually not doing any of the surveys myself. I'll be out in the field with them while some of them are being implemented. But I already have a team in Sierra Leone ready to do this. I've already identified the surveyors, what communities they're from, what communities they'll be working with, what their hours are, and all that, and done everything but signed that contract with them. And they are from their communities that they'll be working in as well. So to answer your question, you're right. This is a huge red flag for anybody who sees it. So thank you for calling me out on it. But it's one of the things that I'm actually pretty concentrated on as well. So to make it shorter, to make sure the people who are providing the survey have had a lot of input into it, of the designing of it. And yeah, I think that those are the two major concerns. I can talk about it pretty much forever. I know people have done 2-hour surveys and that just doesn't work.
Yeah, I think just to follow up with people that have hours. I think just from my own research and knowing prior to doing all of the surveys, how we made sure that you've got time to actually allow those surveyors to build rapport with the individuals before undertaking the surveys. That is probably that I would say was the most.
Yeah, with the timing, we've guessed that they would be doing about 10 surveys a day. And if we can plan for, and I'm paying them a full day's wage for 10 surveys. So if they take that 15 minutes and then they do that, that would be what, 2 hours and a half, and they could theoretically be done, but they have the entire day to finish it out.
And
So
that's suggesting all of those individuals are willing to do the survey that day.
yes, and yes, you're really starting to get into key difficulties, and you're absolutely
I
right.
think it's just it's something I missed. I didn't realize how time consuming it's actually going to be.
And the only thing I can really say in the end is this isn't to hide behind them, but it's that I am working directly with the surveyors who will be in the field, who have like a decade plus of experience doing this. So in no way am I ordering people or like coming in with my own like, I know exactly how this should be done. So I'm doing the best I can.
Go ahead.
I have 3 questions for each presenter. My name is Imran. I'm a teacher fellow here, director of humanitarian engineering lab. So Ryan, just jumping off of what Caroline was asking. One piece I didn't get in your presentation is, what is your analysis plan? How does those 3 data collection activities help you answer your research questions, those 3 domains you laid out? One great piece of advice I heard many years ago was write a paper backwards. What are the conclusions you want to get to? What is the analysis you have to do? What is the data you need to collect to answer that question? Because there's this tendency, especially in survey methods, for bloat, right? You get all these questions. I've done this many times myself of having all these questions, do I cover everything? And that data never gets used, right? So have a really clear plan about what is the outcome you want to evaluate? What is the data, what is the analysis you need to do? Like what sample size you need to answer that question? Then what are the questions you need to collect to actually do that? And that's really going to make your method rigorous and connected and have value for what you're going to, the amount of time you're going to invest in. So that's one prompt to you. And yeah, I guess you don't have to answer that. What is your analysis plan right now? But let me move on to Valerie as well. So thank you so much for that presentation. The recommendations you generated are super valuable to the National Health Insurance Authority and other Ministry of Health and others. What is your plan for communicating those findings to those governmental authorities? Before you respond, let me just pose one more question to Mike. Mike, you mentioned the Chapter 2 data was not ideal for the prototype development. What would be ideal for you, and what is your plan for getting that data? So, Valerie, go ahead.
Okay, so thank you for the question. Regarding the recommendations, I knew, having to put these recommendations out there for policymakers, you need to. So for me, first of all, you need to establish that connection. First of all, who needs to hear this? Who do you need to speak to? So one way I wanted to do that was, interning with them, like working with them, just get to know how the scheme runs, how the NHI is positioned, the various departments, like how everything runs, you really understand, from their angle, and then also listen to the participants and then see the recommendations and see how, both parties can work. So during my internship, I think I got to establish the relationship between me and then the head or the manager of the district office, and then the head of the management information systems. So they were aware I was there for field work. They were aware I was there for my internship. So this is something they just said to me, that when I'm done with the research, they would like to read the paper. And then if there are any modifications or adjustments, that can be made to make the scheme work, they would really appreciate, feedback from, concerning that. So even after the internship, I was asked, what worked well, what didn't work well. I think that was a first step. So hopefully when I'm done writing the paper, I would reach out to them and let them know that these are the recommendations that people are coming up with. And then also during my internship, I think from the few interviews I had, I was able to speak to the head of the management information system, that people are complaining that, the card renewal process, that 1 month waiting period is a challenge for them. So the little I heard from people, I was able to channel that feedback to the head of management information system, which I feel like, it's a first step. So when I'm done writing the paper, I'll just, reach out to them with the final analysis and then the recommendations, and hopefully something good should come out of it. So, that's my plan. Thank you.
Did you want to comment?
The only thing I would comment on is this is, I know exactly what you mean. I think this would end up being about my 7th survey project in Freetown specifically. So I've seen them float when other people are writing them. I've seen my first research, my first survey was exactly what you're describing, and it was terrible, and I've learned so much from it. And then and when you're saying right backwards from like the paper, I like everything you're describing is things I need to tackle for the next semester. I just finished comps and my proposals through the next semester. And one of my goals is to have an entire pipeline from like already picked out papers that I would like, what the paper topic, the findings and the citations, in order to have those questions to answer them, to go, yes, keep going backwards from there. Because it is my dream to like watch survey data come in and have like half of my paper written automatically by the arc or whatever. It's not gonna happen here, but maybe someday.
But the thinking is what's important.
Yeah.
Process.
Exactly. Every project I work on that we're like deciding which category this question goes into after we've already gathered the data kind of frustrates me, and I'm going to do my best to avoid it.
Go ahead.
Question to Brian. Since the resources are limited, especially the human resources, when you're working south, have you considered connecting with Dr. Prabhat Jha? Do you know Prabhat Jha?
I'm not sure what country, where.
He's here in Toronto.
Okay.
You know Prabhat.
He's going to Oxford, though.
Huh?
He's going to Oxford.
He's going to Oxford,
Yeah.
but still he's reaching.
Do you mind if we talk about it afterwards? Because it sounds like a one.
Yeah.
I'd love to.
Well, he's doing work in Sierra Leone. Yeah. So he will have some in-ground staff already trained. So the human resource is always difficult, particularly when you're going into developed nations.
And Prabhat is a highly experienced health epidemiologist and doctor. He has conducted many major surveys over the course of his career thus far, including designing and implementing a national health survey and death survey across India. So he knows what he's doing. If
And
you
he's
have
well connected with ideas.
if you have a,
Yeah.
yeah, if you have a, yeah. And I would also say, Brian, you asked for advice, excuse me, on funding applications, and this applies to everyone in the future. Funders, the first thing that a person is going to look at when they read your proposal, they're going to react exactly as people here have reacted. They're going to say, wow, it's a great idea. Well, this is big and ambitious for a PhD student. That's what they're going to say. And then their next criteria will be, is this feasible? And then the answer will be from their experience, not from yours, but from their experience, the answer will be no. And then they will say, is this fundable? No. So the question, then you have to really think about this from a very kind of operational perspective, right, in terms of how you apply for research funding. And again, this applies to everyone, right? Always have to think about who is the reviewer and who are the reviewers and how will they react to this. These are very experienced people, generally speaking. There's some exceptions, as we know, but they are very experienced people, and they will be rigorous, right? And they're all about operational feasibility, ultimately. Because there's a lot of great questions up there, but then the key thing is this feasible? So I would strongly recommend that you essentially say that you will do this in a phased process, pending experience and funding, and that you will not you will do one community, then pending experience and funding, you will do a second, a third, and a fourth. Now, if you get funding for one, immediately you can start looking for funding for others. Right? Or you may find that, or you may already have the resources and the relationships and so on in place, where even if you get funding for one, you functionally have funding for everything. But just remember, you're trying to convince the peer review committee that you have a feasible project, as well as a great idea, but a feasible project. And the experience is such that, and I just repeat this again, when reviewers look at grants, they look at the graduate student, junior faculty, or senior faculty, basically. Or graduate student, postdoc, junior faculty, senior faculty. And the more junior you are, right, the more attention they will pay to the feasibility question. right? The more senior you are, the assumption is you have a lot of experience and you wouldn't propose something, right, without due consideration of that experience. So just remember, and however unfair or unjust or whatever that may be, that's how it works. Right? And if you want to think about it again from the funder's perspective, not just the peer reviewer, but from this is government money, right? In our case here, this is tax dollars that are funding research, right? And so there is an accountability. So you have to think about the reviewer, but also the funder. They need to see that the research that you can do or you're proposing is feasible, right? And then they'll be open, obviously, to the response. They don't, and this is very much a new kind of, or an increasingly kind of evident climate. There's much more rigor, right, around this question of accountability for use of public funds for research. So just be really, really mindful when you're writing proposals of those suggestions. Yeah, and again, that applies not just to you, everyone. So any questions online?
There was a question from Mike.
I'm sorry?
I had a question from Mike.
Oh, Mike, yes.
Yeah.
Where are you?
Yeah, no worries. Thanks for that question, Imran. So you asked your two questions: what's the ideal data set, and then what's the plan to get that data? As with everything ideal, the answer is it depends. So in this site specifically, we did a SWOT trial, like a safe water optimization tool trial, and the answer was we need more guidance on how to treat water to keep it safe. So what that means for this site's perspective is that we need to be monitoring the treatment processes in addition to what we've got downstream. So there's a little bit of a data volume issue here. So I would want to bump up the amount of fecal indicator data at the household. But then really critically, we need to rigorously monitor before and after addition of chemicals, because that's really where operators have the most control. What is the water quality going in? What's the water quality going out? And then after we collect that data over a long stretch of time, we can both look at trends as well as variability, because we know that we don't have the resources to measure every single mineral in the Kyaka River that comes into that clarifier. So what we need to do is build kind of bulk relationships between things like turbidity and conductivity to figure out how much alum is going to get you between an upper and a lower threshold of turbidity removal. Same thing with chlorination is we need to monitor water quality going into the chlorination process, have the dosing happen, monitor 30 to 60 minutes after, track that time because that makes a big difference, and then keep time stamping measurements throughout the system, on truck emptying, on taps, like when it's collected from the taps and in the household. So that's the plan for, we're going to do this over 4 months, working with the Symposium Training Institute for Social Development, which is the NGO that runs the operations of the Kyaka 2 water system. But then just to show that it does depend, and then in Bangladesh, we've got another pilot going on with MSF, and there the goal is really on the validation of the QMRA. So in Kyaka 2, we're more focused on using QMRA as a way of linking multi-parameter water quality to safety. In Bangladesh, it's really about trying to get as accurate as we can with safety. So in that case, we're not too worried about that upstream data. We're not going to collect that treatment data because there's really not the facilities to do it, because it's just a wellhead with a dosing pump. And then we're going to do. Okay, go ahead.
I know you're really enthusiastic. That's great.
Thanks, Mike.
What's that?
That was the same thing.
Thank you, Michael. That was great.
We have one more question before we merge online.
Let me see. Yep. Hillary, go ahead, please.
Hello. Hi. Sorry, this is also for Mike, so it's going to be maybe fast. And I'm going to follow up with you for a Zoom chat, Michael, so feel free to keep this as short as you want. But I just got back from 6 months in Lusaka talking to water engineers about water quality. So your presentation was like all in that space, which was fantastic. I'm really interested in, you said in one of your follow-up steps would be to think about boreholes. And obviously that's kind of considering different workflows, different processes, depending on the water source. So maybe in 1 or 2 sentences, what would boreholes change in terms of your methodology or in terms of the problems that might arise when you're looking at a different water source?
So with boreholes, we have a lot, like right now those boreholes aren't treated. So what we're looking at is more an assessment than treatment optimization. So we're looking at what's the quality when it comes out of the borehole, then what's the degree of contamination, and then using that to help target. There's an idea to maybe start chlorinating some of these boreholes. So using that to start prioritizing and identifying, trying to build some relationship between easy to measure data and then what we care about, which is fecal contamination health risk.
Cool. Okay. I look forward to
Thank you.
chatting about it. Thank you.
I have a question for Valerie, if you don't mind. First of all, I loved your presentation. I thought it was great. Where were you able, through your phenomenological approach, and also through your inductive and deductive coding, were you able to figure out the process by which delays in payment, either to a hospital or to an individual? So are individuals reimbursed as well? No, it's just the hospital.
Yeah,
So the
so
service is provided at the hospital free if the person has a card. Right.
Yeah.
Okay. So I'm just curious, were you able to figure out through your methodology how you might improve that process, the process of actually registering a patient? You also said that that there's long delays.
Yeah.
And therefore people defect, quote unquote, they go somewhere else, or they just go private, right? Or they don't get anything and they get sick, or they sometimes die, right? Because it's just not an option. So were you able to figure out some of the, like, how that system might be improved, or was that beyond the scope?
So the challenge comes when there are network issues, because first of all, they need to verify if the card is valid, if it's active for them to actually use for whatever healthcare service they need. So the challenge comes when there are network issues. So maybe the network provider, maybe there's data disconnection or whatsoever. So like that's when there's a challenge. So it's actually from the hospital, the way they check for validity. With that one, I don't have much info on that, because I didn't speak to anyone working in maybe admin or records keeping at the hospital. So I can't really tell what the exact issue is when it comes to network and how they are able to navigate it. All I know is that—
So it's a networking, it's a Wi-Fi issue.
Yeah, that's what
Right.
issue.
So that's really important. Did you identify that?
During the interview?
Yeah.
Yes, like it was something that was coming up. Like, people were speaking about it, but
Did you identify it in the recommendations from your study?
I didn't highlight it so much.
Yeah. So I'll just say so it's great that you found it.
Okay.
But I would just say, as a general principle, first of all, your presentation is great. I love the scope and the detail and the specificity and the choice of methodologies. I thought it was very good. It's really, really good. But as you're presenting research, particularly to policymakers, you always want to give people the most practical thing that they can do, right? So very general kind of things, like, for example, the healthcare system is dysfunctional. Okay, that's not a helpful comment, to a minister of health, or to a policymaker, or to a, whatever, hospital administrator. They know that. Right? What they want to see are very practical diagnoses and very practical recommendations. So that would be a really good example, because if you found that, if that came up in your interviews, that's actually a really, really important finding and a really important area of focus where a policymaker can focus and say, okay, it's not the software, it's not the staff, it's not our system or the way we've designed this. Oh, it's actually the Wi-Fi, right? And are there things that we can do to maintain Wi-Fi coverage at the hospital or anywhere so that the system doesn't get backed up, and so that people don't leave, right? And because I just think of, if I were there with my son or my daughter and they were sick, I want them to get treatment. And if I'm going to have to wait in line here for 6-9 hours, I'm going somewhere else. I'm not waiting, and I'll do it. I'll do whatever I have to do, to get my child treated, So being very practical, I think, would be also very helpful. But a really great presentation. Yeah.
Thank you so much.
And then I just have a final question for Michaud. You did say that you did identify early on in the slides a pathogenic profile. E. coli, schisto. I don't know if hepatitis was on there. I can't remember the actual slide. But I'm just curious, Michael, are there regional differences that you are accounting for in pathogenic contamination? For example, a water sample from Canada, if we had an internally displaced person sitting on our border from an inflood or refugee situation on our border from an influx of refugees from the United States in the next few months, who knows? Would the water contamination, pathogenic contamination profile be different from the pathogenic contamination profile in, for example, Africa, Southeast Asia, South America, and so on? And could you modify the tool to account for that variation?
Absolutely, that's a great question. And that was, I think, my second next step about localizing QMRA, if I'm remembering the order right. That's exactly the problem, because so much of QMRA right now is built around, I said it's Dutch data. That's the type of data that's collected from the Netherlands, because they were early adopters. So it's the pathogen indicator ratios and then the effect of consuming a pathogen are both typically based on Dutch data or German data. And that's what we actually shout out to the RAY program at Dahdaleh. We had a great student go through and do a massive literature review. So the next step within this model is to build out those kind of regional pathogen indicator profiles, as opposed to using what's in the WHO guidelines, but really isn't relevant to anywhere outside of the Netherlands.
Okay, thank you so much. That was great. Well, just thank each of you, Michael and Valerie and Brian. They were all very, very good presentations, really, really outstanding. Let's take a little break, and we'll come back at 11:45. So it's just a very short bio break. People need to water or de-water. Okay, we'll see you in a few minutes. And then I'll call on you to do a 10-minute presentation, and that will be followed by a roughly 20-minute-ish question and discussion period. So Hanie Fard is currently pursuing a PhD at Osgoode Law School. She'll be presenting online. She has a long-standing interest in exploring the relationships between law and the environment, and particularly with a focus on the legal mechanisms for environmental protection. And she aims to explore kind of a core question, which is, how can environmental regulations compel foreign investors to be environmentally accountable at the international level? So we're looking forward to listening to Hanie. And then our second presenter will be Liam Michaud. Also, Liam will be online, and Liam is a PhD candidate in socio-legal studies here at York. Excuse me. And his work is informed by critical legal studies and policy studies, and draws on ethnographic participatory methods. And the focus is an examination of the tensions and the convergences between medical therapeutic and criminal legal approaches in how people use excuse me, let me get that right. The focus, there's a lot of words, and I'm just trying to present them clearly. The focus is on an examination of the tensions and the convergences between medical therapeutic and criminal legal approaches in how people who use drugs experience institutional governance and regulation. So that would be fascinating. And then our third speaker is Anna Cardoso. And Anna is a PhD candidate in the Faculty of Environmental and Urban Change. And Anna's research interests focus on coloniality, modernity, and nature as they apply to climate governance and politics, the Anthropocene, and decolonial futures. Anna's research in her PhD explores the concept of colonization of the future and its epistemic implications. And she tries to frame the climate crisis as a site of struggle for the future. So that would be very interesting as well. So with that, I'm just going to invite Hanie to give our first presentation. And Hanie's online, so go ahead, Hanie.
Hello, everyone. Are you hearing me okay?
We're hearing you very well, Hanie. Go ahead.
Perfect. Thank you so much. Hi, I am Hanie. I am a PhD student at Dahdaleh School. I'm interested at the intersection of investment law and environmental law. And today I'm going to talk about the story about what is going on in investment tribunals, that foreign investors cannot be responsible towards environment of the host state. So let me see if I can control. Perfect. So today I'm going to discuss about this question that investment tribunals and environmental protections, whether they are friends or foes, whether they are going to protect environment or whether foreign investors are only concerned about their economic performance and their economic benefits, but on the other hand, host states are concerned about the environment. So it is widely accepted that foreign direct investments is considered as a primary means of financing 2030 agenda for sustainable development. You probably know that in order to have development in developing countries, we need money, we need financial resources, we need knowledge, and we need technologies. And all these benefits are coming from foreign investors. That is exactly why foreign developing countries and developed countries are getting together in order to facilitate the pace of foreign direct investment. And this could be achieved through negotiating international investment agreements. So the question arises here is that how international investment agreements could help the facilitating process of foreign direct investments. There are two major dimensions in investment agreements. The first one is that investment agreements include diverse and numerous investment protection standards. And also there is a tribunal which is established under investment agreements in order to protect foreign investors if they are facing challenges and problems in the host states. So this slide shows that the benefits and two major dimensions of investment agreements. The first one is that investment protection standards like no discrimination, fair and equitable treatment, and lawful expropriation. That means through these agreements, host states are obliged to protecting foreign investors, to not treating them discriminatory, to not treating them unfairly and equitable, and do not expropriate their investment and their activities. And if under any circumstances, foreign investors have become expropriated, or the host state treat foreign investors unfairly, or do discriminatory action against foreign investments, foreign investors are bringing the claim before investment tribunals. And in these tribunals, host states is going to explain that why they have taken this action. And in this tribunal, foreign investors are highly protected against any discriminatory actions of host states. So the process of this tribunal is three major steps. The first step is that investors bring claim before investment tribunals. In the second step, investment tribunals determine whether the investment protection standards have been violated or not. And if the investment protection standards have been violated, the tribunal order host state to compensate foreign investors. So, but the major challenge I am discussing in my PhD dissertation is that we know that not all foreign direct investments are environmentally friendly. And majority of foreign investments have been carried out in GG intensive sector, polluting environment massively, and are considered as environmentally risky activities. And in that scenario, What is going on if there is a conflict between host states who is concerned about the environment of itself, and on the other hand, foreign investors who is environmentally risky, but is expected ISDS tribunal, an investment tribunal, to protect it against host state. So the problem is that in most of these cases, foreign investors are protected and host states still awarded to compensate foreign investors, although they are challenging the environment of the host states and their activities are considered as environmentally risky, they are still protected. So the scenario is like this, as I've highlighted in the blue section of this slide. So environmentally risky investments are not protected by host states. And if the activity of the foreign investors consider that GHG intensive project, host state is going to take action to stop the foreign investments. And in that scenario, there's going to be a conflict between host state, who is protecting the environment, and foreign investors, who is expecting economic benefit of conducting that investments. And so there's going to be a dispute here between foreign investors and host states, and ISDS tribunal is the forum who is making a decision whether the action of host states will be expropriatory, will be discriminatory or not. But as I just mentioned, in most cases, ISDS tribunal still awarded in favor of foreign investors and telling host state to compensate foreign investors. So, and I have done an intensive research to find out what are the reasons behind that decision, why ISDS tribunal often protect foreign investors, not host state. There are two major aspects to this reason. The first one is that there's an ideological underpinning of ISDS tribunal. ISDS tribunal itself is mostly developed and established by the hand of developed countries who are mostly concerned about the economic benefit. And also there is an inequality between developed countries and developing countries when they are coming to negotiate investment agreements. And developed countries have more experiences and diplomatic legal resources in negotiating and drafting investment agreements. So for sure, if one party has more power in comparison to the others, the interest of the powerful party is mostly protected rather than the weak party. So, and there is also another aspect to ISDS tribunal's decision, which is the institutional framework of ISDS tribunals. There are three major doctrines and approaches applied by ISDS tribunals when they are making decisions about the actions of the host states. The first one, which is widely applied and very widespread, is the sole effect doctrine. So as you can see from its name, when the ISDS tribunal trying to make a decision whether the action of host states is discriminatory or not, they are only focused on the impact of those actions on the economic benefit of foreign investors. If the economic benefit of foreign investors have been affected and minimized, so the action will be considered as discriminatory and expropriatory.
So Hanie,
yes.
You're just going to have one more minute, okay?
Okay, yeah, sure.
Thank you.
And another method is the regulatory power. This method trying to make a balance between the host state's power and the foreign investors' powers, but still in action. When ISDS tribunal try to make a decision, they are still paying more attention to what is going on, what's happening on the foreign investments activity, whether the economic performance have been affected or not. And the last method, which is applied by the ISDS tribunal, is project reprisal, whether the the action of the host states have been taken in response to the environmentally risky activity of foreign investors or not. This method is the most acceptable one, but it is very infrequent, is not really applied in ISDS tribunal. So, and through the conclusion, through the examination of these three major approaches applied by ISDS tribunal, I came to an understanding that the investment agreements itself are the major problem, major hurdle toward considering environmental concerns of the host states, because investment agreements only focus on investment protection, not environmental consideration. So my solution in the next step of my dissertation is that, so we need to go beyond investment agreements. We need to consider other international regulations which are considering environmental responsibility of foreign investors, not only their economic rights. So, and if we are applying those regulations, which are imposing environmental obligation on foreign investors and bringing them to investment tribunals, we can make a balance between the right and responsibilities of foreign investors. So this is the first step of my dissertation that I just discussed about it with you. So, and in the next one, I am doing some research on whether those international obligations could be applied in investment tribunals or not.
Okay, Hanie, thank you so much.
Yeah, no problem. Thank you.
Excellent. So I look forward to some questions on Hanie's presentation in a few moments. I invite Liam Michaud to present, and Liam also is online. And Liam, are you ready?
I am, thank you.
Okay, perfect.
Okay, thank you, Dr. Rabinski, for the introduction, and to Natalie and the other organizers for your work bringing us together today. So as mentioned, I'm a PhD candidate in socio-legal studies here at York. I'm in the final stages of my fieldwork, and so what I'm sharing today are some initial reflections on research I've been involved in more broadly. And despite my work being focused on drug policies in Canada and speaking primarily with people in Ontario, my task for today is to share how these things are profoundly shaped by and in turn shape questions of global health. So my research examines the governance of illicit drugs and people who use them. So I use a participatory approach, engaging the experiences of people who use drugs to try to appreciate the shifts in governance that we're experiencing domestically and globally with respect to unregulated drugs, and with a particular emphasis on how criminal legal institutions are responding to the current crisis of drug toxicity and mortality here in Canada. So my project looks at the way in which global trends are inscribed in local dynamics. I'll mention as well that I come to this work having worked in healthcare with people who use drugs, developing harm reduction programs for a number of years, and becoming convinced of the urgent need to think through the legal determinants of health in particular, and that being largely absent from existing policy responses. So my research falls within a tradition of critical qualitative socio-legal studies. I draw on fields of governance and regulation, policy studies, and critical public health to think through these questions. And so the approach methodologically really is around centering people's daily insights into how law and legal governance operates on the ground in their daily lives, to kind of surface the gap that can exist between law on the books and law in action, between formal rights and substantive justice. So this is sometimes referred to as legal realism or law from below. And so this is kind of an approach that guides my inquiry. So Canada provides I think a really valuable case study in thinking through global drugs governance. It was one of the first jurisdictions in the world to proceed with the legalization of cannabis, of course. Canada is also recognized as a world leader in health and harm reduction initiatives for people who use drugs, and yet Canada maintains the shameful status of the jurisdiction with one of the highest per capita overdose rates in the world. So my research asks people who use drugs engaged in subsistence economies and the street-level drug trade about the health and legal governance regimes that they're subject to. So this means I'm asking people questions about healthcare, reasons for healthcare avoidance or non-uptake. This means I also ask people about their experiences of the criminal legal system, how this in turn shapes social practices, including risk practices and health outcomes. So I ask about these experiences to think through how policy interventions engage with or fail to engage with the structural drivers of drug use, drug trade involvement, and drug-related harms. And so these accounts so far surface different trends in governance, whether they're punitive, therapeutic, or a convergence of both. And of course, surface as well some of the limitations of downstream or individually oriented health interventions. So I'd like to take a moment to position the experiences of people locally, because I'm, as mentioned, speaking with folks in South Central Ontario in relation to broader fields of global health. So first, I'll start with, we're witnessing something of a shift in jurisdictions globally, critiques of the criminalization of drug use, and a recognition that this has driven racialized mass incarceration, sustained health disparities. This has all propelled momentum for alternative policy solutions. So jurisdictions across the world, Canada, US, Ireland, Portugal, Mexico, Thailand, to name a few, have all experimented with different depenalization or decriminalization measures. And yet the global regulatory framework, and I'm speaking here namely the UNODC Single Convention on Narcotic Drugs, places severe limitations on what's possible with respect to policy experimentation, particularly when it relates to the health of people who use drugs. And so this shift, if we can characterize it as such, is constrained very much by that context. The second piece of context here, I think that highlights this, these shifts in governance, is the rise of global authoritarianism and austerity politics, meaning that the little momentum that we have seen toward health-based approaches to drug use are both precarious and contingent, facing substantial rollbacks. And so the rise of austerity politics in turn drives economic precarity, driving increased reliance on subsistence economies, including the drug trade. So of course, this has had the effect, and we're seeing the outcomes of this already, of giving rise to the growing scapegoating of people who use drugs, particularly racialized, poor, or homeless people who are unhoused, resulting in a concerted backlash to drug policies that are seen as overly permissive. And so I think this is expressed through, the criminalization of the provision of humanitarian aid in relation to other global health challenges, for instance, migration or support for encampment of unhoused people here in Ontario. I think these presage some of the obstacles that drug user health movements are already facing and likely to face in the coming years. And so we're seeing this play out in relation to the recriminalization of contested harm reduction health interventions here in Canada, with the Ontario closures of supervised consumption sites as just a recent example. And I'll mention the third area of kind of context here that I wanted to share pertains to global supply chains, the role specifically that prohibitionist policies are driving to growing drug toxicity in the unregulated drug supply domestically. So while the overdose crisis for years has impacted namely North America, overdose mortality from drug toxicity and volatility in the unregulated supply is increasing in jurisdictions around the world. So the destruction and eradication of subsistence agriculture, opium and cocoa in particular, has driven the rise of potent synthetic substances manufactured in clandestine and unregulated settings. And so this prohibition-driven creates incentives for higher potency, lower volume substances being trafficked across borders. And this is often referred to in the policy literature as the iron law of prohibition. So I'll highlight a couple of areas, elements that are surfacing in research that I've been involved in recently that highlight this dynamic. The first is that we tend to think about, pardon me, am I at time?
No, you've got about 2 minutes.
Okay, great. Thank you. So for one of these is that we tend to think about punitive and therapeutic in opposition to each other or in tension, but I think there are a lot of important examples of kind of convergence or collaboration, and these don't always necessarily have the desired effects in terms of reducing drug-related harms. And so I highlight a couple of projects here in particular. One concerns Canada's prison needle exchange program that is subject to kind of very security-oriented logic, where prison wardens are determining eligibility, to name an example. The other study I highlight here is relates to police public health overdose partnerships and how these joint responder teams pairing police with social workers raises a number of concerns around law enforcement using health interventions as a pretext to gather intelligence and carry out enforcement efforts. And how this in turn leads to healthcare avoidance, system avoidance, non-uptake. So yeah, I'm going to fast forward a little bit here. So I think, another area that has surfaced so far with respect to people's motivations for drug trade participation, and this will come as no surprise to people who do work with people engaged in subsistence or informal economies. But what is notable is the extent to which social practices that are arguably inherent to drug use. So for instance, sharing, trading, procuring for friends, sharing medications to support a loved one through withdrawal are all practices that run afoul of Canadian trafficking laws. And so this is another kind of key area of vulnerability. So yeah, I'll highlight here one area. This is the last bullet point here on this slide. But another issue that's gaining momentum in Ontario is the laying of homicide charges against people who use drugs who provided, so either sold, shared, or traded drugs that have led to accidental overdose. And this is these charges are proliferating quite rapidly. They target those who are in the lowest tiers of the subsistence drug trade and represent another area in which the law works at cross purposes to the uptake of emergency medical services and healthcare interventions more broadly. And
Okay, Michael, Leon, I'm going to ask you to close up there.
Yeah,
up there
sure.
You go. Perfect.
Yeah, thanks. Sorry for running over time. So the next steps just involve the development of 2 toolkits in collaboration with the HIV Legal Network. One is specifically a community toolkit for people who use drugs and healthcare providers. And the second is a toolkit for lawyers and people working with people who use drugs around the intersection of health and law. So happy to chat more about some of the preliminary recommendations and kind of programmatic pieces coming out of this. And thanks for the opportunity.
Okay, thank you very much, Liam. Anna Cardoso is going to present now, and she'll be talking about the future, colonization of the future in relationship to climate change and environmental impact.
Hi. First, of course, I want to say thank you for everyone involved in putting this together and giving us the opportunity to share our ongoing work, get feedback, and talk about synergy. You can really see there's a lot of synergy here. I'm going to jump right into it because I know we don't have a lot of time and there's a lot to cover, especially because I think I might come from an area that's a lot different from where a lot of people come from here. I'm more from the humanities and social sciences. My work is heavily also theoretically inspired, even though very practical as well. So it's called Fighting for Tomorrow, Colonization of the Futures and International Climate Politics at the End of the World. I'm a PhD candidate at the Faculty of Environmental and Urban Change and the Dahdaleh Global Health Scholar. So the context for my research is, of course, the background is the climate crisis. It's all-encompassing, multifaceted crisis that is not a period of time, but a whole restructuring of our society in every which way, and the impacts are even more stringent. We can see them in our daily lives more and more frequently, more exponentially. Every year is record year in many areas for temperature, for wildfires, for floods, and it's hard to ignore. We can't run away from it anymore. It's not just affecting the frontline people anymore. Everyone is implicated in this, want it or not. So that's the background, of course, for my research, but the more specific context is the failure of international climate politics and policy. And here I'm focusing more specifically on the United Nations Framework Convention for Climate Change, the UNFCCC, because you do have to pick, right? Something, as we were discussing earlier, it's hard to find a scope that's feasible, but we have to make choices. So back in 1992, the very first convention by the United Nations on climate change was signed in Rio, and its ultimate objective was the stabilization of greenhouse gas concentrations in the atmosphere at a level that would prevent dangerous anthropogenic interference with the climate system. Reading this paragraph, which is in Article 2 of the original convention, we can see that that ultimate objective is kind of already failed. It's not just failing, but dangerous anthropogenic interference has not been prevented. We can really clearly see that by reading IPCC reports, especially the sixth assessment that came out last year. And this is no coincidence because right before that first convention, the former president of the United States, George Bush, stated the American way of life is not up for negotiations, period. And that was a very clear jab at the multilateralism efforts that was going to take at the Rio summit, not only for climate change, but also for desertification, biodiversity, and other thematic areas as well. And this doesn't only show negligence or lack of will to engage with international negotiations on the topic. It's an ontological project, is what I'm arguing, of extending this way of life through time. The American way of life, and we're going to get into what that means, which for me is rooted in coloniality and capitalism, it needs to extend itself and reaffirm itself through time for it to work, because it needs to be the only alternative for it to work. And we can see some of the results of this non-engagement or actual butchering really of international climate policy in the shortcomings of the nationally determined contributions, the main current mechanism of international climate policy, which are not only insufficient, but even the insufficient targets that were set are being under-implemented. So not even that them are going to be achieved. And now more recently, COP29, so the 29th conference of the parties of that original convention that was held in Baku, Azerbaijan, just a few weeks ago, and I was there, was probably the most failed conference of parties of all time since 1992 in terms of lack of agreement. There were many areas that needed to be agreed upon, like just transition and mitigation, that simply had no agreement text whatsoever at the end. Finance was the main topic to be negotiated in this climate conference, and it was very, very, very lacking. Even party delegates protested the outcome because there was lack of consulting, lack of transparency in the process. And that also leads to this general multilateralism crisis that we're facing in other aspects as well right now. And the prognostic is not great because, you know, who's going to be president next year and probably withdraw from the Paris Agreement again is Donald Trump. So some of the objectives and proposal of my research it's an ethnographically inspired study of climate futures at the UNFCCC, looking at international climate politics and within this UN system as a site of disputes for the future, meaning which future is going to exist, but also if it's going to exist at all, considering the estimates and the data that's coming out. So how persisting colonial dynamics and their ontological premises, which I'll try to get into very briefly, limits these international climate efforts and threaten the very existence of a future. And then I brought this quote by Sultana on what decolonizing climate futures would be. It means accounting for and reflecting on past and the present in order to figure future pathways to remove colonial and imperial powers in all their forms. So that's the underlying objective of my research. Some of the guiding questions I have are, how have historical processes co-produced particular futuristic frameworks? And how does it entail particular understandings of nature, humanity, and time? So getting from the past and colonial history and legacies, and now we have this coloniality, just precisely this structure of power that is rooted in the colonial past, but still very much present in structuring our society today, how that shapes and also is shaped by particular vision of what the future looks like. If we talk about the future, probably the image that comes to everyone's minds is flying cars and going to Mars and not saving the climate, for example. So that was something that really triggered me into looking at alternatives. And so what are the co-constitutive relationships between these ideas we have of the future and the projects that actually seek to enact them in the present, focusing on international climate politics? So the ideas we have about what the future will look like or should look like that are constrained very much by this colonial mindset and imagination also shape how we actively work towards the future. So I'm developing this concept of colonization of the future, proposing the future as a territory under colonial occupation, in which the settler or this modern colonial imaginary displaces, assimilates, and exterminates pluriverses of possibilities, imagination, desires, narratives, alternatives, and let's be frank, bodies and lives as well. It's twofold concept. On the one hand, there's an ontological and epistemological dimension that's rooted in this coloniality and more specifically in the universalization of this colonial project as the only vision, the only possible alternative, which creates specific particular ideas of what humanity means as separate from nature, nature as this objective, external background and monolithic thing, and not pluriverse of lives and beings and ecosystem processes that are intertwined with us and our society and how we manage our lives. And it also produces very particular conceptions of time as a linear temporality. So it's rooted in this progress, ideal for development and modernization that sets humanity in a linear timeline, putting some societies as the epitome image of the future and relegating some societies to the past, and therefore excluding so many different lives and narratives, imaginations from any possibility of existing in the future. And there are the more practical political dimensions, which in the sense of climate policy, and this is also some preliminary findings here. I'm grounding it on climate false solutions. So false solutions would be market-based mechanisms,
Another 30 seconds.
finance mechanisms, and these non-proven techno fixes like geoengineering, carbon capture, sequestration, and more they are pervading all of the thematic areas of climate negotiations and interfering with actual mitigation, adaptation, and reducing greenhouse gases, and thinking about alternative ways of relating to the climate, producing energy and existing in the planet. What makes them false is that they divert tackling the root causes of climate change and maintain this system and business as it has been constructed to operate. So I'll kind of skip through this because I know I'm out of time, but it's also just to bring this idea of the end of the world and situate ourselves in the era of the Anthropocene as, ironically, this colonial modern idea of what the future should and will look like has created a possibility of any future not existing at all, which is what we can see with where the climate crisis is leading us. At the same time, we have to question, when we talk about the end of the world, whose world's ending? Because many worlds have had to end for this one to exist. And this idea of progress and everything that we're talking about relies actually on the appropriation and extermination of many human and non-human worlds.
Stop you there.
Yeah, I'm just gonna finish looking at this imminent end of the world as, and this uncertainty that it brings as also possibility and the time window to make it mean actually the end of this world that we know and build other ones instead.
Okay, thank you very much. So we're open for questions for a few minutes. And please raise your hand if you have a question. Go ahead, Imran.
Thank you, Anna, for that presentation. It's super provocative. I think you're giving words as well to an idea that it's kind of circulating in the culture, an idea, but I haven't been able to express. So that was super fascinating to hear expressed that way. I think you're giving me words to describe this phenomenon that's emerging. I'm reminded right now, this idea of colonizing the future. There's an economic critique that's been emerging more in recent years as well. And recently, there's a book published by Wolfgang Streeck, who's a German sociologist and a theorist of capitalism, critiquing or looking at the history of neoliberal capitalism and its crises over decades. And he talks about the 1970s in the in the fallout of the oil crisis, when quantitative easing or expanding the money supply became the policy option of choice of states to deal with this problem of the conflict between labor and capital. And that basically is borrowing from the future, expand money supply to borrow future productivity and use it to pay for things now, right? So there's a parallel in the critique you're making about colonization of the future and economic policy in neoliberalism since the 1970s. So I would recommend check out that book by Wolfgang Streck, because I think he makes that case very, very forcefully there. And there's a really strong parallel.
Great.
Thank you.
Other thoughts or comments online? Anybody? Paul? I saw it. No. Okay. So I had just, Anna, I have a question for you. So I agree very much with Imran. The language that you've used and the way you formulate it gives expression to felt feelings that many of us have. And if I take I would just say that in my own case, I've been involved in this issue of climate change and global response to it for a very long time, and other issues of the global public commons, is how I would put it. And I always think historically, and I know that is something that is linear, but linear too is a reality, right? And it's the most common reality. And so that's very important in terms of how people engage and how people understand a way forward. So one of the things that I often have thought of over the years is how the process or our process of change has changed in time. And so just to give an example, with the abolition of slavery, that process from beginning to its imperfect end, because slavery still exists, took about 400 years from the expressed ideation to the spread and to the manifestation of that ideation through law, practice, and so on around the world. And then the emergence of women's rights, labor rights, children's rights. I'll be very brief here now, just trying to not take up too much space. And now the issue of grappling with climate change and environmental biodegradation, or degradation of the biosphere. That process gets shorter and shorter and shorter and shorter and shorter. And so from 1992 to now, what's the math? That's 32 years. That's a very, very short time. And it's the first time in human history, truly the first time in human history, where we have a global collective understanding of the nature of our problem. And we have a global collective commitment, vaguely, I'm not sure that's a good word, to actually begin to address it. So my question to you is, if I think of where we're going, there's this inevitable confrontation that is emerging. And in your view, what processes can help us, and I think I'm using the word us as the kind of collective humanity, all of us, all 8 billion of us, help us through a very difficult, there's all kinds of nice euphemisms for this these days, a very difficult tension point that is, and in a way that is nonviolent. Is that possible in your mind? And that is a very long question, but I think it's one that preoccupies me a fair bit.
I also think that is the big question that we all try to answer in our daily practice and perhaps in our professional practice as well. I don't think that's a question that can be dealt with, because I think the conditions of possibility for this change to happen are still upcoming. Or, historically, we don't know how to deal with problems until we are dealing with them, and new realities emerge out of that tension. I'm not a studier of violence or revolutionary processes, and I also don't intend with my research to give answers or solutions, because they already exist. Many people already bring them all the time. Indigenous peoples are giving solutions and living by solutions every day. Even other climate justice civil society movements are going every year to these conferences and experiencing a lot of violence. They are very, very dense spaces and very violent spaces, especially for people of color and for women and for youth. And having to deal with climate anxiety and with futures being stolen, especially thinking about youth who are not part of the decisions but are the ones bearing the most consequences in terms of who's going to be here to face the most dramatic events. But I also think it's important to reflect of how violent the whole process has been up to now, right? Not only the historical conditions of genocide and ecocide that have led us to how this system works and emitting gases, if we want to put it very concretely, but everything that surrounds it, but also the violence in terms of the impacts of climate change and the impacts of the so-called solutions that it proposes. Geoengineering basically creates sacrifice zones in a lot of indigenous people's land, especially in the Arctic. So I think we were going to have to deal with what is violence, and I don't know. That's not a question that I usually raise in my research.
Thank you. Go ahead.
Yeah, I just want to pick up a little bit on your point, James. Recommend a book, and this is a comment and question for all the last three presenters, and thank you very much. Very provocative, interesting work that you're pursuing. There's a 2016 book by Thomas Friedman called "Thank You for Being Late." And he sort of gets at the point that James was making, which is that throughout the course of human history, the ability of a society to adjust to change has been at least 10 years. And over the course of time, that's gotten shorter, as James mentioned. But sometime around 2007, 2008, Friedman argues that we passed a critical point at which the pace of change now exceeds the pace of our ability to adapt to change. And that has created enormous angst in the world and given rise, I would argue, to a certain populist movement at the moment that pines for the past and simple solutions in people's minds. And some of the barriers that we face are being advanced by individuals who oversimplify the challenges and the related solutions, legally, environmentally, et cetera, et cetera. I think a challenge for academics, and academics are increasingly, as part of that populist movement, seen as part of the problem, not part of the solution, which is highly unfortunate. So I think part of our challenge is that we're going to have to find a way to speak in a way that resonates with a broader group of individuals in the same way that populist movements have done. And so my question to all three of you is, when you're finished your work, have you given some thought about how you might take it from an academic environment and develop a message that is much more likely to resonate with the general populace and ultimately, therefore, influence senior decision makers? Because they're not going to move unless they think that they can win elections and other kinds of things, right? So how do we influence the public in a real way and deal with the angst that is real in their lives at the moment. Right now, they're hearing all the problems. They're not hearing some of the wonderful ideas that you have. So how do we do that?
So I'll ask Liam to address that first, and then Hanie, or unless Hanie, you are eager to go, you're welcome.
Thanks for that question. I think it's a really important one. I'll share a couple of thoughts, and again, I'll kind of limit my remarks to questions of kind of drug policy, healthcare policy, because that's what I'm most familiar with. I don't necessarily think that the same kind of strategies are necessarily applicable, across all domains. But I mean, what you're saying around the need to develop messaging that resonates with people's affective and experiential engagements with the world is, I think, really important. And I think that's partly a tactical or strategic question for instance, people trying to advance evidence-based healthcare policy or law reform or what have you. I think that's part of it, but I wouldn't want to necessarily overinvest. I do think that it requires a diversity of tactics and a diversity of strategies, and I think it's quite clear that to the extent that rights-based approaches and the legal system are up for the challenge, and there's a lot of questions about that, we're going to be, at least in terms of drug policy, it's quite clear that we're going to be any gains we make with respect to healthcare policy are going to be fought in the courts for the next number of years. And so I wouldn't want to, overinvest in a singular strategy, although I think I think your point is well taken in terms of the need to really think about messaging and really kind of admit to ourselves that evidence is not enough, right? On its own, evidence is not enough. I'm not sure, like in terms of the pace of change piece, I'm not totally sure, because I think there's been a lot. So again, with respect to drug policy, there's been a lot of unevenness, and I don't think that it's a matter of moving too quickly. And I want to take a closer look at Friedman's book, so I'm not sure if that's his thesis, right? But in terms of the pace of change, because I think these are really longstanding, enduring problems, and there's always these cycles of backlash, retrenchment that we've seen, at least in terms of healthcare policy and drug policy.
Okay, thank you, Liam. Hanie?
Yeah, thank you so much. That was a very interesting question to me, because when I started to do my PhD dissertation, I've always been obsessed about the practical aspect of my dissertation. I just didn't want to do just doctrinal or theoretical research. I was very into the practical aspect of that. So, and my finding during my dissertation gonna be to offer tribunals, particularly investment tribunals, to consider specific international regulations and the potential applicable law in investment disputes. Especially those rules could be considered as soft law in theory, but in practice they could oblige foreign investors to be environmentally responsible. So one sources of international law is a scholarly argument, and I believe if we can publicize this idea that soft law could be considered as a hard law in some sense to oblige foreign investors, it's going to be a practical way to move forward to make a balance between investment and environment. And also I am thinking of being involved in the negotiating process, especially my back home when they are negotiating investment agreements with the developed country and trying to motivate to bring foreign investors into my back home for their knowledge, for the financial resources or technologies. I am gonna give some recommendations to consider some provisions, especially on environmental considerations, because it is unavoidable that for sure during the process of investment activities, we are going to face with environmental issues. And if they are they are just stopping foreign investments or stop issuing permits, they're gonna be sued in investment tribunals. But if they are consider some environmental or sustainable development provisions in their investment activities, they can defend themselves or justify their actions in investment tribunals.
Excellent. Well, thank you, Hanie and Liam. and Anna for those presentations and for your very thoughtful answers. So I'm just going to close with a couple of very quick comments. So we've had presentations this morning on safe water optimization, use of artificial intelligence, and different modeling systems to improve water quality for refugees and internally displaced persons. Also had a great presentation on an analysis of a healthcare system in Ghana from the perspective of how to improve the national health insurance scheme, with actually some really good concrete recommendations, despite my prior comment. And then a presentation on seasonal variation of urban water security in Freetown, and then presentations on a presentation on transnational environmental obligations for foreign investors, and then on securitizing risk around the legal determinants of health among people who use drugs, and then finally a presentation on colonization of the future and international climate politics at the end of the world. So I just want to say that the Dahdaleh Institute is a institute that is committed to a multidisciplinary perspective and has been since its inception, and around three very specific themes: planetary health, global health and humanitarianism, and global health foresighting. And today's seminar really marks for me yet another example of how successful we have been in really encouraging and enabling, very directly enabling, with lots of resources and time and space and mind space and effort and energy, pulling people together, forcing people to sit and listen to each other, to actually try to understand what the other person is actually trying to communicate. This seminar really marks, again, another very good example that this can be done, and that it can be done with very positive effect in terms of how different actors at different levels of society can approach challenges of global health. So I'd just like to thank everyone for really, really good work and really good presentations. And I wish you the very best for the next semester. Keep going, and just go the next iteration and make your thoughts and language and presentations and your willingness to listen, which is actually more important, in fact, than your willingness to speak. We live in a time of polarization on so many levels, and we, at some level, have forgotten how to speak and how to listen, and we've forgotten the very basic elements of a polity, and one of those basic elements is civility. And civility requires not only assertion. We, in an age of polarization, we tend to assert, we tend to declare, we tend to accuse, we tend to shut down others who express views that we don't want to hear or that we find, quote unquote, uncomfortable. And I think we really need to move beyond that. We need to return to some basic principles. And the basic principle that I think is most important is civility. And civility requires those two things. Yes, to speak, but more importantly, to listen. And to listen and genuinely try to understand, to stand under. That's what understand means. To stand under and to see what the other person is trying to express. That's the beginning of a multidisciplinary perspective. And so fora like this and spaces like this, where we really do struggle with that effort to listen and to speak, genuine, like, what are you actually saying? And that I can, and please try to say it in a way that I can understand it. This is a very, very important space. And I'm happy that it exists. And I'm delighted to anticipate that it will continue to exist. And I wish every one of you extremely well. And with that, we will close our 5th annual symposium, and there will be a 6th, I'm sure. So all best. Thank you.
Thank you.